Welcome, and let's talk about melasma, a skin condition that causes spots and patches to your face, which are darker than your natural skin tone.
Most get it on their chin, nose area, forehead, cheeks, and the upper lip.
Can sometimes also affect your arms, neck, and back.
In fact, melasma can freely affect any part of your skin that can be exposed to sunlight. This is why most people with melasma get horrified because of how symptoms worsen during summer.
Melasma is a common skin disorder and is a much more common problem to women than men,
though it can develop to men too. Source from American Academy of Dermatology, 90% of the people who develop this disease are women. It's also called cloasma when pregnant women are victims.
The word cloasma means mask of pregnancy. Word melasma comes from the Greek word melas, which basically means black.
It is not really classified as infectious, therefore it is not contagious, which means this disease is not spread from one person to another. Melasma is caused by allergy, and certainly not cancerous.
Melasma is actually a lot more common to people of color, and people who can tan very quickly,
but of course can occur to anyone. The disease can also occur to any culture or population, but it's way common in Asian, Middle Eastern, African, Mediterranean, and Brazilian countries.
So what is the behind this grave disease?
Here's a cross-section of the skin, which shows cells of the skin arranged in different layers. You can clearly see a large pigment among these skin cells that is producing a cell known as melanocyte. Melanocyte cells have finger-like projections called dendrites which extends throughout all over your skin, so that the pigment produced can be fairly, equally, and evenly produced to your whole skin. Here comes the part where melasma develops due to the overproduction of melanin by these cells, that can be a consequence of overexposure to sunlight, for example. When our skin is overexposed to sunlight, melanocytes become too hyperactive and starts producing excessive melanin, causing the development of darker spots or pigments to the skin of your face or anywhere else on your body.
A lot of factors can also play, such as genetic predispositions, ultraviolet rays, type of skin, hormonal factors such as when in pregnancy. Hormonal therapies and oral contraceptives are one of the main risks of triggers of melasma. Additional factors that can play into development of melasma includes cosmetics, certain medicines like anti-epileptic drugs, and photosensitizers. Several research suggest that melasma can also be correlated with zinc deficiency. Unusual thyroid function, change in skin color is the only big indicators of melasma.
Brown patches symptom don't hurt, itch, or physically cause you any harm at all. The patches are usually an even gray-brown to brown in color,
usually evenly shaped. Melasma also often shows patterns. Common patterns of melasma when it shows to your face include the mandibular pattern, malar pattern, and centrofacial pattern.
Centrofacial pattern affects the central part of the face commonly, including nose, forehead, cheeks, upper lip, and chin area.
Next is the malar pattern, which mostly involves the lateral cheek areas. Lastly, the mandibular pattern, which affects the lower jawline. Now that we have brief knowledge about what melasma is, let's talk about mental impact of melasma. Multiple studies shown results where psychologically detrimental and devastating effects that melasma causes to our quality of life.
A study where 140 people with melasma from India found that 70% of these people with melasma disease were mentally and emotionally bothered by it. 42 of these subjects confirmed that melasma comes with embarrassment, depression, and had a huge negative impact to almost all of their relationships with other people. The psychological consequences of this disease affects young and old patients alike. There are also studies that prove that quality of life was worse in unmarried female patients that has melasma. Melasma is generally diagnosed and confirmed based on clinical presentation, or also another method which involves special lamp known as Wood's lamp. It involves the usage of ultraviolet light for a more closer examination of the skin. Melasma can be classified as epidermal, dermal, or mixed depending on where the melanin in the skin is located. They are rare cases where there can be confusion with your doctor. That's why your doctor can ask for a skin biopsy, which is a very small part of your skin, and is taken to make sure that the brown patches are 100% melasma. But confirmation of melasma often can be very challenging, with incomplete data in many cases, and frequent relapse. The patients must adopt to a consistent treatment system to make sure relapses are avoided. Education and counseling about avoidance of the main triggers. Risk factors for melasma, such as sun protection, is the very key in importance during or after the treatment is a necessity for a successful treatment. Photoprotection is one of the key components for a successful melasma treatment. One of the best ways to prevent melasma from worsening is by protecting yourself from UV radiation, avoiding the sun, wearing white-brimmed hat when outside, and wearing spectrum sunscreen since UV rays are known trigger for melasma and other skin diseases. UV rays can also cause hyperpigmented patches. Even more dark wearing sunscreen can greatly help avoid melasma from hyperpigmentation and flaring up from getting worse. Highly recommended to have a 30 or above SPF rating of a sunscreen, with high UVA rating. The more effective the sunscreen against melasma will be, the more it has higher SPF rating. Protecting your skin from the sun can help medicines be more effective and faster in treating your melasma. Now, let's get into some topical medications that are used in treatment of melasma. For people with mild melasma, doctors recommend using skin lightening creams as the first line of therapy. Skin lightenings can be basically divided into two types: those that have hydroquinone and those that do not. 4% hydroquinone creams can be applied to affected areas once or twice in a day, for about 2 to 4 months. Can also be extended to 6 months depending on your situation. Hydroquinone works by providing you enzyme that is required in the synthesis of melanin. Non-hydroquinone skin lighteners, on the other hand, has azelaic acid, niacinamide acid, and kojic acid. Can be used separately or in combination with hydroquinone. First alternative line of therapies, particularly in patients who doesn't have tolerance to allergies that hydroquinone can cause, and for patients with moderate to severe melasma. Triple combination creams is used against melasma as well, that contains tretinoin and fluocinolone hydroquinone. Fluocine is a mild effective steroid, and tretinoid is full of vitamin A. Cream is applied nightly for 2 to 4 months. It can take several weeks before you see the results of this treatment, so it's important to consult and follow your doctor's recommendation. Even if you haven't seen any improvement yet, you should keep treating your skin even after your melasma goes away. It is also important to avoid excessive sun exposure and to use a good sunscreen. Taking care of your skin daily will also help to prevent melasma from returning. Now let's touch briefly on the role of antioxidants in the treatment of melasma. A randomized double-blinded study made by Ahmad and to all 66 Hispanic females with melasma to study the role of antioxidants in the treatment of melasma. The female subjects were divided into two groups, 33 females each in the first study group. The females were only advised to use sunscreen 2 times a day. In the second group, in addition to applying sunscreen, the females were also given Polypodium leucotomos extract, which is an oral antioxidant. After 12 weeks, the group with oral Polypodium leucotomos extract resulted in a 28.8% improvement, and the group that simply used the sunscreen resulted in only 13.8% improvement in the melanin index. This shows that antioxidants can also have a positive effect in the treatment of melasma. Now, if the creams are not effective in the treatment of melasma, the second-line treatment is used, which includes chemical peels. In this procedure, we use products such as glycolic acid, salicylic acid, trichloroacetic acid, or Jester's peel. Chemical peels can improve melasma by removing the outermost cells of the skin that contain the pigment. Glycolic acid peel is done in a dermatologist's office, and it is a quick and effective way to rejuvenate the skin. Dermatologists use a 30 to 40% concentration of glycolic acid, and it stays on your skin for only 2 to 3 minutes, after which it is washed away. Chemical peels should be performed by an experienced practitioner only, as inappropriate peels could make the pigmentation worse. Scarring superficial chemical peels are a treatment option for patients with melasma that do not respond to topical therapies alone. While the term peel makes the treatment sound quite harsh, it's quite gentle. Actually, you'll feel some tingling, but there's no burning, redness, or discomfort for the next 5 to 7 days. Make sure to treat the skin gently. Do not use any exfoliation products or devices, and it's very important that you use protection against UV exposure, as the skin becomes very sensitive after a chemical peel. Lasers and light therapies are the third-line treatment for melasma, appropriate for patients in whom topical treatments and often chemical peels have failed to produce adequate improvement. They should be used with great care and caution, particularly in patients with darker skin, to minimize the risk of post-inflammatory hyperpigmentation. The success of laser therapy is variable, and there may be risks associated with. That'll be all for this video. If you're too stressed about your melasma, do remember that beauty lies in the eyes of the beholder, not in the color of your skin. Thank you. Take care.